Cancer Diagnosis and Treatment, a comprehensive guide. Cancer is a devastating disease that affects millions of people worldwide. Being diagnosed with cancer can be overwhelming and terrifying, but it's important to remember that there are numerous treatment options and resources available to help you on your journey to recovery. In this article, we will discuss the process of cancer diagnosis and the various treatment options available. The diagnosis process. Cancer diagnosis typically begins with a visit to your primary care physician, who may refer you to a specialist such as an oncologist. The diagnostic process involves various tests and procedures to determine the presence of cancer cells and identify the type and stage of cancer. These tests may include imaging scans, blood tests, biopsies, and genetic testing. Imaging scans such as X-rays, CT scans, or MRI scans allow doctors to visualize the affected area and detect any abnormalities. Blood tests can check for certain biomarkers that indicate the presence of cancer cells. A biopsy involves taking a small sample of tissue or cells from the affected area and examining them under a microscope for cancerous cells. Genetic testing can help identify specific gene mutations that may increase cancer risk or help determine the most effective treatment options. After a proper diagnosis, the stage of cancer is determined, ranging from stage O, precancerous, to stage 4, advanced cancer that has spread to distant organs. This staging helps determine the appropriate course of treatment. Treatment options. Cancer treatment approaches vary depending on the type and stage of cancer, as well as the patient's overall health. The primary treatment options include surgery, radiation therapy, chemotherapy, immunotherapy, targeted therapy, and hormone therapy. In many cases, a combination of these treatments may be recommended. Surgery involves removing the tumor and surrounding tissues, either through traditional open surgery or minimally invasive techniques. Radiation therapy uses high-energy beams to kill cancer cells or shrink tumors. Chemotherapy uses powerful drugs to kill cancer cells throughout the body. Immunotherapy helps boost the body's immune system to fight cancer cells. Targeted therapy involves drugs that specifically target the genetic mutations or proteins present in cancer cells. Hormone therapy is used to slow down or block the hormones that fuel the growth of certain cancers, such as breast or prostate cancer. In addition to these treatments, clinical trials may be available for patients to explore innovative therapies that are still being researched. It is imperative to consult with your healthcare team to determine the most suitable treatment options based on your specific diagnosis and individual circumstances. Support and care. Coping with cancer can be mentally and emotionally challenging, so it is crucial to have a strong support system and access to various resources. Seek support from family, friends, and support groups who can provide comfort and guidance. Mental health professionals and counselors can also help address the emotional burden of a cancer diagnosis. Additionally, cancer treatment centers often provide comprehensive support services such as nutritional counseling, pain management, physical therapy, and access to clinical trials. These resources aim to improve the patient's quality of life during and after treatment. In conclusion, a cancer diagnosis is undoubtedly a life-altering event. However, with the advancements in cancer research and treatment, survival rates have significantly improved over the years. Remember to stay informed, seek the guidance of medical professionals, and take advantage of the available support systems. Cancer treatment is a journey, and with the right support and treatment options, there is hope for a brighter future.